by now literally hundreds of studies that look at the impact of racism on the health. Primarily, the studies are done on African Americans, with African Americans. So there are now increasingly studies done with other populations as well. And those studies make clear that what's interesting is that there is an extra burden of racism that is both beyond class. So what happens is that, of course, racism sort of operates both upstream of class and independently of class. But
Right.
what I mean, of course, is that African Americans, because of racism, tend to be pushed down into, for lack of opportunities, into less affluent positions in American life. Yet, even after correcting for that, there are still impacts on health from living in a society such as ours, which puts those extra special burdens. And one of those big studies, for example, is that African American women with a college degree who get prenatal care, who do all the right stuff when they're pregnant, actually have a higher risk of delivering a preterm baby than does a white woman, a white mother, who hasn't finished high school. Now, some people say, oh, that must be the genes. That must be in the genes. That's sort of default, interestingly, in this country, go back to the genes. Well, there's many ways we can take that apart, but there's a study that we talked about in the film, in the episode When the Bow Breaks of Unnatural Causes, by David and Collins, that took a look at African American immigrants to the United States. So these women, they gave their babies were the same birth weight on average as white American women. However, their children, in other words, when they became their children, when they gave birth, when they became African Americans, suddenly their babies were in fact lower birth weight. And when their children's children gave babies, even more so. So what has happened? Did the genes change when somebody came across the Atlantic from Africa?
Right.
No, of course not. What happens is that living in the stress of this society clearly has an impact on the body of the mother through the life course.